Why do different species show varied sensitivity to toxicants? Sensitivity differences arise from anatomical, physiological, and metabolic traits. For example, rabbits tolerate belladonna due to an esterase that hydrolyzes atropine, while horses and rats unable to vomit are more susceptible to toxins like red squill. Ruminants, on the other hand, may detoxify compounds like acratoxin A or bioactive others like nitrates via ruminal microbes. How does the inability to vomit influence toxicant susceptibility in animals? Vomiting limits toxin absorption. Rats and horses cannot vomit, making them more prone to oral poisoning. Red squill, a rodenticide, induces emesis in species that can vomit, providing a safety margin, while rats retain the poison and succumb to its effects. How do ruminal microorganisms affect toxicity in ruminants? Ruminal microbes can either detoxify or activate toxins. For example, bioactivation. Cyanogenic glycosides cyanide, nitrates nitrites. Detoxification. Acratoxin A acratoxin Greek letter alpha, aflatoxin B1 aflatoxical. Thus, the same compound may be harmless or deadly depending on microbial metabolism. What role does urinary pH play in renal clearance of toxicants? Urinary pH affects reabsorption. Acidic urine, for example, in dogs, retains weak acids like NSAIDs and acratoxin A. Alkaline urine, for example, in herbivores, retains weak bases like caffeine or strychnine. Hence, diet and species influence toxicant excretion through urinary ion trapping. How does enzyme expression influence species susceptibility to toxins? Enzyme deficiencies lead to vulnerability. For instance, sheep lack enough G6-PDH low glutathione are susceptible to copper, nitrites. Cats lack UGT1A6 poor acetaminophen detox. Turkeys have low GST acai aflatoxin B1 sensitivity. What are phase I and phase II biotransformation pathways? Phase I, functionalization. Adds groups, O, NH, via CYP enzymes. For example, CYP1A epoxidizes aflatoxin B1. Phase II, conjugation. Adds polar molecules, for example, GSH, sulfate, detoxifying the compound. Phase I may create reactive intermediates, while phase II generally neutralizes them. Why are horses more sensitive to monensin toxicity? Horses have lower CYP3A activity, reducing monensin metabolism. LD in horses. 2-3 mg/kg. In rats. 35 mg/kg. In chickens. 200 mg/kg. This reduced detoxification results in accumulation and toxicity even at low doses. What genetic factors make cats and dogs more susceptible to some drugs? Cats lack UGT1A6 and NAT2 can't glucuronidate or acetylate toxic buildup of acetaminophen and sulfonamides. Dogs lack NAT1 and NAT2 sulfonamide metabolism is altered, forming reactive and toxic metabolites. Result: greater risk of oxidative damage and immune-mediated toxicity. How does breed influence toxicant metabolism and sensitivity? Greyhounds. Low body fat plus poor CYP2B sensitive to lipophilic drugs like propofol. Collies. MDR1 gene mutation PGP dysfunction ivermectin enters brain neurotoxicity. These breed-specific traits demand tailored dosing and drug choices. What is the function of P-glycoproteins in drug toxin protection? P-glycoproteins, PGPs, pump out toxins from the brain, intestines, and kidneys. In MDR1 mutant dogs, for example, collies, drugs like loperamide, ivermectin, and vincristine cross the blood-brain barrier unchecked, causing sedation, tremors, or even coma, while wild-type dogs remain unaffected.